to ensure Massachusetts is prepared to respond to a potential outbreak in the state. The planning is part of the state's emergency preparedness protocol. Our administration has been in regular communication with the CDC, U.S. Health and Human Service agencies, local public health departments, other federal agencies, and other interested parties to discuss the latest guidance and recommendations. This communication will continue, and we'll keep the public informed so that everyone can remain prepared. In fact, this afternoon I participated on a conference call with the White House and governors from across the country to hear an update from federal officials. We were briefed on current travel restrictions that are posted on the CDC and Department of Homeland Security websites and provided an update on resources and supplies that are being stockpiled and made available if necessary. So far, our Department of Public Health has taken several strategic steps to respond to the coronavirus and to help the public stay safe and prepared. While Secretary Sudders and Commissioner Burrell will go into further details, I want to share a few. The Department of Public Health has launched a state website where the latest information and facts on coronavirus are available, established an incident command structure to serve as an organizational system in the event of an outbreak. This will help with information sharing, decision-making, and response efforts statewide. Implemented procedures for voluntary home self-quarantine for individuals returning from travel to China, remain engaged with local boards of health, schools, emergency management service providers, and hospitals to provide the latest guidance and offer state support. Provided clinical and infection control guidance for hospitals and healthcare systems, and disseminated detailed public health guidance and recommendations to school superintendents, charter school leaders, and principals throughout the Commonwealth. DPH will continue to monitor the supply chain of personal protective equipment such as gloves, face masks, and other equipment within the U.S. And DPH is in regular contact with the Commonwealth's hospitals to ensure that they are prepared. On Friday, DPH also announced that the U.S. Food and Drug Administration approved Massachusetts to begin testing patients for coronavirus. This means clinicians with patients who may have symptoms consistent with coronavirus and meet the current CDC definition of a person under investigation can contact the Massachusetts Department of Public Health to discuss their patients and receive authorization to submit specimens for testing. This will serve as a useful resource to expedite test results. And if necessary, the Massachusetts State Public Health Laboratory staff and epidemiologic staff will perform surveillance of potential cases. Regarding international travel, the White House yesterday announced new restrictions, including a heightened travel advisory for certain regions of South Korea and Italy, and expanding a travel restriction to Iran. The State Department has previously urged people not to travel to China. Travelers are encouraged to monitor the State Department website for new information. Again, the Department of Public Health has created a public website for our residents, which can serve as a useful resource for individuals, families, businesses about coronavirus. And please continue to check mass.gov/2019 coronavirus for updates. DPH has also posted preparedness information like that at mass.gov/no-plan-prepare. We'll continue to monitor the coronavirus and prepare our state for any and all possible scenarios. In terms of what you can do to protect yourself, please remember to wash your hands often with warm soap and water, cover your mouth if you cough or sneeze, and stay home when you're feeling sick. We're still in the midst of flu season, and we urge residents to get a flu shot if you haven't already done so. Part of the reason we're here today is to let you know that we are thinking ahead